So the traditional format was more of like just a creator showcase interview style.
Mhm.
So this is a little bit different than what we'd originally planned for. So I'm kind of thinking that you'll probably just take the reins on this and just kind of be
Mm.
an open conversation.
Yeah, I agree.
Mhm.
Yeah, I have a list of information of basically to explain personality disorders broadly, and then specifically borderline personality disorder. Lots of information on borderline personality disorder.
Okay. Um, do you have any expectations of us by chance? Just wondering.
Um, I would hope that you would be, engaged, asking questions if you want clarification or don't understand something or are curious. Um,
I mean,
I'll be talking about. I expect to be talking about also my personal experience with it, as well as like the psychiatric and research on it.
Cool, cool, cool.
mm.
Just I figured that's probably what you were expecting, but I just had to make sure there weren't any like I don't know. You would be disappointed with the contents because we didn't know what was going on either.
No pop quiz or anything.
Thank fucking God. I am not
The only
taking
thing
notes.
I've done was a little bit of research. I was looking at the different clusters and the personality disorders.
And I was like, saying the way some, like in cluster A, right? Some people with extreme autism or ADHD might have it too, on a certain extent. Not like a borderline personality disorder, but has some symptoms. If you get what I mean. I don't want to be disrespectful if I if it sounds like it.
Let's save the juice. I don't think we're live yet.
Oh no.
Well, technically speaking, aren't we?
I mean, I'm streaming, so yeah.
Yeah.
Can they hear
Yeah.
us?
Yeah.
Oh, okay, cool.
Oh,
You're on Be Right Back. I thought I was like they probably can't hear us, right?
Well, I'm on a stream, so yeah, I can hear us.
What's up, everybody? Fuck yeah.
what's up? Oh yeah.
What's up, chat? All right, thank you for coming. If you'd like to introduce yourself.
Hi, I'm Batista Invicta, also known as Batista, more commonly known as Tista. I'm a Twitch streamer, variety streamer, very small, very, very soft. Please love me. Or
Aw.
Papista. Izo calls me Papista. I'm here to talk about borderline personality disorder from a clinical perspective and from my own experience with it. Briefly touching upon, very briefly touching on personality disorders in general. I don't really intend to go into detail with the clusters or anything like that. Um, the first thing I want to make sure that we get out of the way, I don't want to forget this, is trigger warnings. Everybody, please pay attention to this. This will go over suicide, self-harm, various mental illness, and everything associated with it. There are some fairly dark parts to this. I mean, if anybody has any objections, I can leave certain things out.
No objections here.
I'm here.
Nope.
I'm good.
That's
Okay.
good.
All right. Does anybody have anything else to say before I start the? I guess just start introducing personality disorders in general.
We got Mousy on the call too. He hasn't been on the podcast yet. Mousy, you want to introduce yourself?
I'm Mousy.
Awesome.
Nice.
Killed that,
Nice
man.
to the point. He plays Gundam too.
I
So
play games.
He is also a member of Delta V. The little food.
That.
I'm Mousy. Hope you fuck.
mousy rousey.
All right. So we're gonna start with what are personality disorders in general. So according to the National Institute of Mental Health, a personality disorder is a, quote, enduring pattern of inner experience and behavior that deviates markedly from expectations of the individual's culture. That is per the Diagnostic and Statistical Manual on Mental Disorders, called the DSM. The current version is DSM-5. This is very important to remember. It's a manual on mental disorders, basically. So, further, these patterns tend to be fixed and consistent across situations and lead to distress or impairment. So essentially, a personality disorder is a deviation from the cultural expectations, and it is something that is consistent and causes distress or impairment. This is true for a lot of things in psychiatry. Like a mental illness isn't really mental illness until it starts interfering with your life and it starts impairing you and causing you distress and anxiety and everything like that. Based on diagnostic interview data from the National Comorbidity Study replication, about 9.1% of adults have a personality disorder. So almost 1 in 10 people actually have a personality disorder, are actually diagnosed, not including people that are undiagnosed. So they're not uncommon.
I did not realize it was that common. That's a big percentage.
Me either.
Yeah. Wow.
Well, I mean, there's a lot of different personality disorders.
True. Yeah,
True.
Like you were talking about the clusters, like paranoid personality disorder. I mean, if you've known anybody who's particularly paranoid, that might be a personality disorder. Antisocial people, narcissists, people overly dependent personality disorder, people who are overly avoidant, obsessive compulsive. There's tons of different personality disorders. So it's not unexpected, because there's a lot of different types of people. So do we have any questions so far?
At the risk of playing the role of dumbass in the room, because that's just kind of what I do sometimes.
No, please
to
do.
sum up what you had said first. So it's basically just there's like an assumed culture that people just kind of figure out and learn when growing up, and it's defined as not developing that culture.
It is a deviation from cultural expectations. So yeah, like something might not be a personality disorder in one culture, but would be in another. Kind of like how something that is a disability in one country might not be a disability in another country.
That makes
Like-
sense.
Because of different like social circumstances, like government funding and support. Like you might me personally, for example, I don't have disability yet or anything like that, but I am basically unable to work because of just how labor works in America. But perhaps if I move to a country like Sweden or something, I might be able to work. And so mental illness and personality disorders can kind of work the same way, like change across different cultures.
I see. Thank you for clarifying. That makes sense.
How do how you be like, I might have a personality disorder. How is that diagnosed?
I will be getting to that later, actually. There's a whole section on that.
Oh.
One last thing. About 1.4% of people have borderline personality disorder, are confirmed diagnosed with borderline personality disorder. There will be a little bit more information on that later, too.
Okay, cool.
And that was the last bit about personality disorders in general. So, what is borderline personality disorder? Essentially, it's a mental disorder that is characterized by difficulty regulating emotions, unstable moods, unstable behavior, unstable relationships, and identity disturbance. Identity disturbance, very important. We'll come back to that later.
Mhm.
Borderline personality disorder is often shortened to BPD, which is not to be confused with bipolar disorder, which is just BP. I
always
also
confuse the two.
Yeah, I also have bipolar disorder. I have BP and BPD. So it officially became a personality disorder in the DSM-3. So we're on DSM-5, so DSM-3 was 2 versions ago, which was a few decades ago by this point, I think. I think 1970s. So 1.4% of adults have been diagnosed with borderline personality disorder, but it is estimated that 2 to 6% of people may actually have the disorder, but it's been diagnosed or just undiagnosed. Maybe it's been misdiagnosed or undiagnosed.
Mm-hmm.
So it's actually not that uncommon at all.
And that's like worldwide?
This is all of this information is generally being applied to adults in the United States.
Adults in the United States. Okay.
It'd be a wider spectrum if it was, or a wider percentage if it was worldwide.
Perhaps, yeah. So that section pretty short. Do we have any questions about what BPD is?
Nope.
Difficulty
good about
regulating
it.
emotions, unstable moods, behavior, relationships, identity disturbance.
Oh,
Key.
So I'm like dating somebody who has bipolar, and it's my first time. So sometimes when he told me when he's manic, he buys a lot of stuff. Like he very impulsive. So I don't know if it's like what do you do when you're manic? If you would like to share that.
That is unrelated to borderline personality disorder, but I will answer
Uh,
that. I will answer that at the end though, because I do have an answer for that.
oh, okay, okay.
I will just let me just make a note. That can be an additional talking point.
that's also what I was gonna say. A lot of the stuff gets misdiagnosed, like ADD. Sometimes gets because you're antisocial. Then you suddenly get labeled. You have a personality disorder because of the fact is, oh, you just don't like social.
Right. Yeah, that's a good point. A lot of oh, before I forget, real quick, Starry, what was your question exactly?
Oh, which one?
How to deal with
About
manic episodes.
mania?
Uh, what do you do exactly when you're manic?
Okay,
Like,
I've made a note. Okay.
yes.
So yeah, that was a good point, Link. It's also very common for people to be diagnosed with multiple personality disorders. Not as in multiple personalities, but several personality disorders at the same time.
Hmm.
It's actually pretty common for a person to have. If they have one personality disorder, they'll probably have another too. So it's not a very, and this field is constantly changing. Like the DSM is not just 100% correct, automatically correct. It is constantly changing. Definitions are added, removed. Definitions are changed. That's why there's constantly new versions. That's why there's different manuals besides the DSM that are used. DSM is probably just the most common and authoritative. So yes, people are going to be misdiagnosed with personality disorders and with a lot of things because it's just an extremely complicated field. Why is it called borderline personality disorder? This is a common question, and it's a little bit contentious with people who actually have borderline personality disorder. In earlier versions of the DSM, which used a different diagnosis system to the current version of the DSM, people were basically classified as either psychotic or neurotic, and it was noted that some people, the neurotics, sometimes appear to be on both sides of the border when in crisis, hence borderline. They appear to be both psychotic and neurotic. And so it's kind of a relic. It's not really accurate anymore. There's been debate for a long time about changing the name of it, but the only other name that's been commonly used is emotionally unstable personality disorder, and basically I've never seen anybody who has BPD who likes that name. You tell somebody, you tell somebody, oh, I have emotionally unstable personality disorder. It's like, whoa, okay, like
Right.
that.
Okay, back up.
Yeah, if I tell, I'm sorry, Link.
Oh, I was saying no. It's just somebody would come up to me like that. Like, does that mean I need to hide my knives? What does that mean?
Yeah, it sounds really bad. But if you say, even though borderline personality disorder is inaccurate, it's it allows for more a discussion more openly because I say, I have borderline personality disorder. It's not evident what that means exactly, so somebody can then ask what that means. Why is it called that? That actually it
Much
kind of
more palatable.
yeah, it actually allows for a conversation. It doesn't sound as scary.
Mm-hmm. You said that it's defined as borderline because it is. You seem to both be. You said psychotic and neurotic at the same time.
Yes, usually
Could you-
usually in some sort of crisis.
Could you explain to me the difference between, like, I don't know what that necessarily means when compared against each other.
So like, what is like psychosis versus neurosis?
Yeah, I guess so.
So, I'm less familiar with the different neuroses, but those include things like obsessive compulsive disorder.
Nice.
Psychosis, and I'm actually going to get back to this later, talking about psychosis later, is basically a detachment from reality, usually in some kind of crisis, in which the person will experience hallucinations and delusions.
Okay. No, that makes a lot of sense, actually.
Yeah, so if somebody's borderline, they might experience features of both at the same time. At least that's how it used to be classified.
Hmm.
Any more questions about why it's called BPD or anything like that?
No, but I have a story that goes along with PD. It's kind of the reason why I got booted out of the Marines is because I guess they found that I had a BPD, avoidant antisocial, anti-personnel behavior.
You've had all of those?
Yeah.
Oh man, okay. So you would say you might have multiple or several personality disorders.
Yeah, that's like I didn't, expect. It's like, oh, well, you can only get one, but then I looked into it and then I realized that yeah, it's not just one. It's just like how no person has the same fingerprint.
Right. Yeah, and that's a good point too. A lot of people experience a lot of these personality disorders in their own way, and a lot of people experience mental health, mental illness in their own way. So, have you been diagnosed with any of these personality disorders?
Outside of the Marines, from there, I psychologist, not really, because I haven't been to a doctor, and because the American system is pretty shitty.
Yeah.
Naturally.
Like, if you try to go for any kind of diagnosis, there's a big stigmatism about getting help, about the cost. You shouldn't have to worry about that. Like, it's just something a lot of people go undiagnosed because they don't want to go see a doctor or can't afford it.
Yeah. I hope that this discussion about personality disorders and BPD will be somewhat enlightening and elucidating for you.
Yeah.
Okay, so here's where it starts getting really meaty, and where we start getting into some of the nastier parts of dissociative disorders like borderline personality disorder. I'm gonna go over the various symptoms of BPD. There's quite a few. So if you have a question or a comment, I'm gonna pause after each symptom to give you a chance to say something, and then I'm gonna continue on because there's a lot of symptoms, and I'm not gonna give you 15 symptoms and then expect you to like respond to all of it at once.
Oh, that's fair, yeah.
All right, so according to the National Alliance on Mental Illness, symptoms of BPD include frantic efforts to avoid real or imagined abandonment by friends and family, unstable personal relationships that alternate between idealization and devaluation. This is sometimes called splitting. An example is what in one instance you really love somebody, but in another instance you really hate that same person. And you kind of flip back and forth. That would be idealization versus devaluation. Distorted and unstable self-image, which affects moods, values, opinions, goals, and relationships. That one's very important. That's related to identity disturbance. Impulsive behaviors that can have dangerous outcomes, such as excessive spending, unsafe sex, reckless driving, or misuse or overuse of substances.
Definitely had a friend who fell into that category.
This music is no longer
Occasionally, when things
Gucci.
didn't go his way, he always like drove, and then somehow he was safe, but always told me, I always wondered when I'm gonna crash, or I wanted to drive so reckless that I just ended everything.
Yeah. That's not uncommon, especially it also appears in other personality disorders and mental illnesses like bipolar disorder.
Yeah.
Yeah, that's what I was like talking about. I do have impulsiveness problems too, but not as bad as my boyfriend though, because I can control it somewhat. Sometimes he can't. He just spends and spends and spends until his mania goes away.
Yeah. I would like to talk more about that at the end. Because there's a lot of good information there too. Next symptom is self-harming behavior, including suicidal threats or attempts. So BPD has a suicide rate of 10%.
Oh, Jesus.
Oh wow, damn.
Which is 400 times higher than the general population.
Jesus.
It's estimated that 40 to 85% of BPD patients will attempt suicide an average of 3 times. Roughly 50 to 80% of people with BPD will engage in non-suicidal self-injury, so self-injury without intent to commit suicide. 50 to 80%. Over 41% of people who self-injure will do so over 50 times.
I definitely fall in that category. I can, short say I've attempted, and I've done self-harm. I've stopped since because I've got a really good friend system now. But before, I was in a bad state, and I can definitely tell you, the amount of times I've tried.
Right.
My medication was really strong. I just have ADHD, but it was like really strong, and I almost attempted, but then I backed out, and I told my mom, and she took me to a therapist because it was like, oh.
Yeah, that's good. I mean, getting to, if you can, like, please, everybody, if it is within your means, please see a therapist, because therapy can be life-changing.
Helped me a lot.
Sure.
So yeah, self-harm and suicide is an incredibly massive problem for people with BPD. I will go into more detail about that later, about the nature of the self-harm and suicide later. The next symptom is periods of intense depressed mood, irritability or anxiety lasting a few hours to a few days. Something that can be difficult is if you have another mental illness and you also have borderline personality disorder, is discerning what is making you depressed. Like, I have bipolar disorder and borderline personality. So, how do I know what's causing my depression or my anxiety or my irritability? And I mean, one way was that I got properly medicated for my bipolar disorder, and I'm pretty confident now what I have left is symptoms of borderline personality. So I do get these intense depressed moods, irritability, anxiety, just seemingly for no reason sometimes, that last hours to days. Next is chronic feelings of boredom or emptiness, and I will expound upon that more later. Inappropriate, intense, or uncontrollable anger, often followed by shame and guilt. Generally, the person gets way too angry, and they know they're way too angry, but they can't do anything about it, and they feel very bad about it, especially if they've hurt somebody because of it. Inappropriate, intense, I said that one, dissociative feelings. This is a big one. which are disconnecting from your thoughts or sense of identity, or having out-of-body type of feelings, and stress-related paranoid thoughts. Severe cases of stress can also lead to brief psychotic episodes. Again, psychosis is thought and emotions that have become so impaired that contact is lost with external reality. Delusions, hallucinations. So, dissociation, basically, is another symptom. Those are the symptoms listed by the National Alliance on Mental Illness, but there are more, in my opinion, and in the opinion of other researchers at least. Suicidal ideation is pretty obviously implied with the high rate of suicide. Doublethink and double binds. I know those of you who have read my mental health post, I have mentioned doublethink and double binds. But I will go over it again. Doublethink is holding multiple exclusive or contradictory opinions or positions simultaneously. So, sometimes believing opposite things to be true at the same time.
Like overthinking?
No, like I'm struggling to think of an example, but basically, like, you have an opinion, and you believe that opinion to be true, and then you also have another opinion which contradicts the first one, but you also believe that one to be true.
Oh.
So it's sort of like, this is just me throwing out an example. I think it's an example, but so you're very much pro-gun, but at the same time you're like, but we shouldn't own them.
That could be an example of doublethink. Are you familiar with 1984, the novel? So one of the core ideas in the book is doublethink, in which people have to, they live under very oppressive regimes and are forced to think certain ways, think certain things in certain ways.
Oh, it is the George Orwell. Okay, yeah. I've heard this. We actually had to do a study of this in English class.
Yeah, so there's doublethink where it's like these people have to believe what they're told, and they have to truly believe it because the government can tell, but they also have their own identities and personalities and believe what they want to believe at the same time. And that's essentially what doublethink is for people with borderline personality. Like, I'll get into an example right now. With double binds. Double binds are cases in which a person is sending two conflicting messages at the same time, such as wanting to be left alone, but not wanting to be alone. Pretty common for me. And it's frustrating for other people because you're obviously sending conflicting messages. There is no winning solution, right? Which is insanely frustrating. It's hard to describe. It's hard to describe what it's like to basically constantly be dealing with that sort of thing, where it's like every decision feels like a losing decision.
I mean, no mental illness is easy to deal with.
No, I just find it. I've just found that people have a really hard time imagining like what that feels like.
Yeah, that's hard to wrap my head around.
Yes.
Yeah.
It's the
I
whole
don't
dissociative.
understand it. Sorry, go ahead.
I'm saying it's the whole dissociative personality thing in this time and age that everybody dissociates with everybody else's problem. Like, they'll look at it and it's like, oh, that I feel bad for them, but at the same time you can't imagine how they really feel.
Yeah.
Like, I just can't wrap my head around it.
Like,
But because if you're living it, you know it, so you get what the other person's putting out.
like, you try to understand where they come from, at the same time you get frustrated and stuff like that. So I try to be patient, but obviously you're a person and the other person is, you don't know how to deal with it, so you get mad and you know you shouldn't, but it's like, ugh.
Right. Which is why, please, if you know somebody with any mental illness, please be patient. If you know somebody with BPD, please be extra patient, because they're also frustrated.
Imagine.
I think I'll touch upon this again later also. So then we have difficulty trusting others, which is sometimes accompanied by an irrational fear of the intentions of other people. I myself am a pretty skeptical and suspicious person.
Mm.
I do have a very hard time trusting people. One of the last one, which is also very important, is sleep disturbance. Such as difficulty initiating sleep, difficulty maintaining sleep, and waking up earlier than desired. This is both acute and chronic sleep disturbances, so you might have some of these more intensely lasting for a few days, or you might have some of these lasting over longer periods of like months. There is an association between borderline personality disorder and poor quality of sleep, essentially. And getting bad or no sleep can make the other symptoms of BPD worse, as is the case with basically all mental illnesses, though. Or everything. If you don't sleep, everything is worse. Do we have any questions?
Yeah, I'm going to touch upon something I'm seeing happening in chat that I'm also resonating with. It's like the more symptoms we hear, it's like, fuck, do I have BPD, or are these symptoms just somewhat relatable? Is that something that's common? Because like I was thinking that, and then Link says it, and then Mousy feels it, and Azoria feels it.
I kind of feel it too.
I mean, again, personality. Almost 1 in 10 people are diagnosed with a personality disorder, so there are most likely more people who are undiagnosed or misdiagnosed. It's not necessarily that everyone will have BPD. There are other dissociative disorders, and other personality disorders that will share some features.
Mm-hmm.
Like Izo was saying, anxiety disorders have a lot of overlap.
Yeah.
It's really, I highly suggest you avoid trying to self-diagnose a personality disorder.
Oh, of course.
Yeah.
Yeah.
Like, if you feel depressed, you can say I'm depressed, but like with something like BPD or like schizoid personality disorders or any other dissociative disorder, it feels kind of dangerous to just assume you have that and try and just live with it. I would suggest seeing a therapist if you can.
It's
Right.
also like listening to WebMD.
Highly recommend a therapist because, like I said, like I got like what you did, like one time it was really bad that I only ate Kraft powder cheese and soy sauce and throw up every night, and it was really
God.
bad. And like what you say with certain things, like one time like you can feel empty with BPD.
Mhm.
I got that once and that was scary, really scary.
Oh, what, the emptiness?
Mm-hmm. It felt like nothing.
Oh yeah. We'll go into that again. We'll go into that more too.
Mm-hmm. And back earlier last year, I was actually diagnosed with bipolar, along with I can't remember if it's called whatever the word is in front of depressive. Major, it's major. It was major depressive and somewhere on the spectrum for anxiety. And the therapist who had told me that I had bipolar said that she thought it was just level 1 in remission. And so I was like, okay, well, I guess if that's what you think, I probably don't need to learn anything about it. And then she said, cool. And we didn't really talk about that a whole lot because that wasn't really why I was there. That was just kind of part of the intake process. Um, and then a whole bunch of weird and also, a bunch of tough stuff has happened since then. And it's like, okay, so is that bipolar? And should I have learned more about that while I was seeing a therapist?
Oh man. She said type 1?
Yeah, she said bipolar 1 in full remission.
Um
I was like, that sounds, that sounds fine. You know, that clearly I'm dealing with that, and that's fine. But
Bipolar 1 is
No.
super spooky in my opinion.
fuck, I just thought that meant it was the lowest level.
No, there's type 1 and type 2.
No.
I have type 2, which is basically a lot more depression focused. Type 1 is we'll just talk about this briefly. We can actually talk about this at the end too, about bipolar disorder. So how is BPD diagnosed? There is no medical test to diagnose borderline personality disorder. There's no single test you can take, or you can't draw blood or anything like that to diagnose it. And diagnosis is not based on a single sign or symptom. BPD is diagnosed by a medical professional, usually after a clinical interview, and it's going to be based on symptoms and behavior as a whole, sort of like a holistic approach where it's going to be considering like the cluster of symptoms, English, and your behavior as a whole. So it's a very involved process, not necessarily fast, and it's going to really be analyzing a lot of your life. So now we're on to identity disturbance and the importance of a consistent sense of self. This gets its own giant section because identity disturbance is so important. It is a core feature, if not the core feature, of borderline personality disorder. And it part of the problem right now is that it lacks an overarching psychological context, as in like it's not defined in the DSM-5. Identity disturbance, that is. There's no official definition by the DSM. And so there are multiple interpretations of what identity disturbance actually is. I've tried to just get at the core features, the core common features that I've seen in the research. And those features usually include feelings of emptiness, perhaps as a result of not feeling like you're one with your body, or that your body is basically just a tool. I feel that often. I often feel like I am just like a brain piloting meat on a bone scaffold.
What a terrifying way to say that out
I
loud.
know. I love it. I love it so
the
much.
visual, though.
I love it so much. And also you might feel like yourself, as your id, yourself, might feel like it is outside of your body. Like where you comes from might not feel like it's inside of you. Another feature is unstable affectivity, which is basically affectivity being the degree of a person's response or susceptibility to pleasure, pain, and other emotions. So like how much you respond to various emotional stimuli is your affectivity. And people with BPD and identity disturbance will have an unstable affectivity, which means like in one instance, I might be very resilient to some emotional stress, to a certain emotional stress. But in another instance, I might be suddenly very susceptible to a very similar emotional stress. So it kind of makes things pretty unpredictable, trying to think of like, how will I respond to something? It's very difficult to say. Another feature would be unstable moods. I'm not going to go into much explanation on this one, or at all, because it's unstable moods. You can probably see why they're unstable moods. It will be briefly touched upon again.
Right. We all have moods. We could probably imagine it.
Yeah.
The one of the worst features of identity disturbance is the self-mutilation, self-harm, self-injury. They all mean the same thing. For somebody with identity disturbance, self-injury can be a form of rapid self-help. It basically provides a temporary relief from things like anxiety disorder or chaotic thinking, unstable and rapidly changing emotions, hallucinations, delusions, depersonalization. It kind of acts as a way of grounding a person, like placing them back in reality. It can also be a form of emotional expression. And because of this, self-injury is often a protective factor against suicide. Actually, basically in acute cases where a person is suicidal, self-harming can avert the suicide. Because it allows people to break their dissociation. It makes them feel more grounded in reality. It can make somebody feel more alive in general. And risk of suicide does not increase while self-injury, as long as the self-injury keeps producing that same kind of relief. But BPD patients that do self-injure are about twice as likely to commit suicide than those that don't. And repeated self-injury can increase dysphoria, which can lead to increased risk of suicide. So basically, in acute situations, as in somebody is actively suicidal, self-harm can avert the suicide. But that person is twice as likely to commit suicide in the first place because they self-harm. So it's kind of a mess. It's pretty bad. The next core feature of identity disturbance is the disturbance of interpersonal relationships. And that could be a result of having unclear goals, having unstable moods, having unstable affectivity, like self-harming, feeling empty. Like none of that is good for a relationship, right? Like none of the stuff we've talked about so far is good for like any kind of interpersonal relationship.
Boys in our personal relationships.
I'm sorry?
I was saying, yes, anything it destroys it.
Yeah.
People start feeling alienated to the point where it's like, what can I do for them?
That too. That too. Sometimes like when you can't help somebody, it feels really bad. And I mean when you can't be helped, it feels really bad. Next core feature would be a disconnect. This is one of my favorites, honestly. A disconnect with your past and future self, and sometimes your present self. There's this professor for philosophy and psychiatry at the University of Heidelberg. His name is Thomas Fuchs, and I love the way he described borderline personality disorder. He said, living with BPD is, quote, an atemporal mode of existing, as in atemporal as in outside, like lacking time, as in outside of time. Because you don't identify with your past self, you don't identify with your future self. Oftentimes, you don't identify with your current self. You don't feel like a person in the present time. So, like, where are you time-wise? Like for me personally, like I don't feel like the same person I was even kind of some months ago, especially not years ago, especially not like I basically don't even remember the vast majority of anything from when I was like 18 to 23. And my memory of anything of time, my perception of time over the long term is very bad. On a day-to-day basis, like I can estimate, like I can pretty accurately estimate like what time of day it is, like what time it is, and like I can say how long 15 minutes is. But if you ask me if something happened like 2 weeks ago or 3 weeks ago, I have no idea. Did it happen a month ago or 3 months ago? I might not be able to tell you. I might not remember it at all. So you might feel like you essentially can only live in the present. or you're basically just outside of time if you don't have a current like stable sense of self. Like if you don't have a stable sense of self and you don't have a past self and a future self, like time just feels incredibly weird and is almost meaningless. And that's gonna also be really bad. Part of the reason why it's so bad for relationships is because it's like you don't know, you have unclear goals because you don't know what your future self is going to want. I have this problem. If somebody wants to make plans like for something a month in advance, like I'm kind of apprehensive. But if something is like 6 months in advance, a year, multiple years in advance, I have no idea if I'll still want that same thing by the time it comes. And the final thing is yes, the unclear goals related to the disconnect with your other temporal selves. It makes committing to long-term goals very difficult. Okay, so does anybody have any questions about identity disturbance? About the affectivity,
I
unstable
relate
mood?
to it a little bit. So I know I said I have like ADHD, but I have like a small bit of autism. And since I'm a woman, it's harder to diagnose me with it than a man because a man is more evident than a female. And some things you said, I'm like, I kind of relate to it. But like you said, I might have to go to the doctor again to see, because I got diagnosed when I was 7, so I probably have to like go to the doctor again as an adult and see how that is. Because sounds like I might have it, but I don't know.
Yeah, identity disturbance can happen outside of borderline personality disorder, but it is a key or the key feature of
Mm-hmm.
borderline personality disorder. But
Mm-hmm.
it can happen in other cases.
Mm.
Any other questions or comments? Feelings of emptiness, affectivity, unstable moods, self-harm.
Yeah, as I've been saying in your chat, I also can relate to a lot of the feelings of emptiness. It's just like you lose your purpose, and it just feels like there was a time where time felt really weird. Like I know I was in a moment, but at the same time, it just felt like it was going on forever, and I wanted to end because I wanted to get away from it because I felt like I was self sabotaging, and then that would lead to moods of I think this is my fault. This is why things went. So I started self harming. I ended up it. I said it started out as small gashes. Then I started taking box cutters, anything really sharp that I could do damage to myself, and just to escape myself.
Yeah, that definitely makes sense with the feelings of emptiness and the kind of loss of time.
Yeah, the way I used to describe it was that it felt like there was a void that was sucking anything, that any kind of like happiness or any feeling, and all that was left was this empty feeling that I knew there was this void, but I didn't know how to fill it. I tried everything. Self help or self harm seemed like a way, but then I realized, no, it's not. I've already ended up in the hospital twice. One time I was almost medically dead.
Mm.
Jeez, sorry to hear that.
So definitely a lot of this resonates with me because I've experienced it. And it's just like I get the emptiness. It's so difficult to describe it, but it always feels like this black hole in the middle of the center of your chest that's absorbing everything.
Yeah, I think that's relatable for several disorders and illnesses and people in general sometimes. Um, did anybody else have any questions or comments?
Uh, maybe like, so I get this thing called brain fog. I know a lot of people do. It's natural when you're tired and stressed, but for me, it happens randomly. Like it did today, and I was talking to my boyfriend, and I felt bad because I wasn't really paying attention to him, and like how you felt like what's it called?
Associated.
Dissociate. Yeah, thank you. Sometimes it happens, but luckily for me, it lasts at least a day, and then it goes away usually. But a couple of weeks back, it stayed like for 3 days. I almost fucked up my school, so I was like, oh
Hmm.
shit. This needs to go away.
Yeah.
This is no bueno. Go away, please. And luckily I got better. I did mention it and vented it in Ira's Discord about it because I didn't know what to do because it never lasts for 3 days. So I was worried about myself. I thought I was like, oh shit, am I going back when I used to be when I was on the medication? But then it started to get better, then it went away.
That's good.
Yeah.
I'll move on to the next section. What are the causes of borderline personality disorder? One would be genetics. There is no specific gene or gene profile for borderline personality disorder. You cannot identify, look at a gene and say if it's present or not present or what have you, whether or not a person will have BPD. People who have a close family member with BPD may have a higher risk of developing the disorder themselves, but there's not a very strong genetic component. One of the strongest is probably two, which is the environment, specifically from trauma, such as but not limited to physical or sexual abuse or neglect. But it can be trauma of many kinds. And lastly would be brain function. So the areas of the brain responsible for controlling emotions and decision making just might not be communicating effectively with one another. Basically, the different parts of your brain just aren't working together correctly. It's just a neurological defect, essentially. Yeah, that's basically the causes of BPD. It's not super well understood. Any questions or comments about that section?
Is there a section for what I was going to ask about this is, do you think that also BDP B BPD can also be developed via a chemical reaction within the brain, sort of like how ADD, ADHD, a lot of people end up who get off of it have an addiction to something, or their impulse control is zero. So after they get off of that medication, they suddenly they have some kind of like personality disorder.
I couldn't say. I haven't seen anything about it in any of the papers I've read. I don't think I would want to speculate on it personally.
Okay.
I'm trying my best not to speculate in this. I'm trying to use all my research powers. Any other questions or comments about the causes of BPD?
So and I don't know if you're similar, but like for example, my aunt has depression. Uh, and it's I don't know if depression is also genetic because that's a hard word for some reason. BBTD, damn,
I know.
is it's also not genetic. I don't know if they're intertwined because the press kind of goes with it, right? Or am I like understanding that wrong?
Can you repeat the question or rephrase it slightly?
So my my aunt has depression. I don't know if it's true because I don't have it or anything, but like chronic I don't it's I think it's genetic, but you said BBTD. Damn it, it's
Don't worry,
it's
it's okay.
not genetic. I know you guys like you get like depressed
Mhm.
with your disorder. Does the depression of like maybe somebody a member has like a family member have like depression and it goes in there too, or it just comes with the disorder?
Um, I believe that would just be a factor of the disorder. I mean, the person. It's kind of hard to say like why a person is depressed.
Mm.
Like in a lot of cases like this, where there's a personality disorder involved. But at least with BPD, there's not a strong genetic factor. Um, Again, if you have a close family member with BPD, you may have a higher risk of developing it yourself. But there's no strong genetic indications about like quote unquote inheriting the depression or anything like that,
Mm.
with BPD at least. All right. We're gonna move on to the last mandatory section, and then there's one optional section.
Extra credit.
Um, so we're on to the bright side. We're gonna end on a positive note. How is BPD treated? Um, Unfortunately, like all other personality disorders, uh, it is not curable. Um, if you develop a personality disorder, it cannot be cured. You can only manage it. But a lot of personality disorders can be very successfully managed. Um, there are some very effective treatments. Um, Specifically for BPD, I'll be talking about. There is psychotherapy, such as dialectical behavioral therapy, um, cognitive behavioral therapy, um, that's DBT and CBT, respectively. Um, those are the two primary methods of treating borderline personality disorder. Medication is not really the solution for borderline personality disorder. Um, the the key factor in long-term improvement is basically just learning how to cope with your emotional dysregulation. Like it's just learning the strategies and learning how to live with it will just make it better for you. Um, Medications can be used to treat the various symptoms of BPD, though. There are no medications that are designed specifically for the disorder. But there's mood stabilizers, antidepressants, and antipsychotics that can be used to treat the various issues that come with BPD, such as mood swings, disorganized thinking, um, affective dysregulation, and hostility. In this case, affective dysregulation means it's something like irritability, but basically it's an excessive reaction to a negative emotional stimulus, uh, with a response of like anger and aggression. So you can use all these various medications to treat the various parts of BPD, but in almost all cases, therapy is going to be the biggest and key component. And then uh, another method of treating, quote unquote, treating BPD is hospitalization. Um, in times of crisis or severe stress, like sometimes you just got to go to the hospital because you're having a huge crisis and you can't deal with it. Um, but that is one way of dealing with like the acute short-term things. Like, you know, if somebody with BPD is having like a major crisis, they go to the hospital, they're observed, they're treated until they're through the crisis, and then they can, if they're not on medications and therapy, they can hopefully start medication and therapy, or they can continue it with some improvements or something like that. It's just another tool that people with BPD can use. Yeah, mood stabilizers, antidepressants, antipsychotics. All very nice. I love all of those things.
All those things.
Oh.
That's it for the treatment of BPD. If you have any questions,
Yeah.
I do have a section for the definitions and talking about DBT and CBT and stuff like that. That's optional though.
Okay. So, I mean, of course, the medication, it just makes it kind of easier to deal with, but you said there are forms of therapy that can treat it. Does that mean like therapy, you learn tools to deal with this better, or is it a therapy that can make symptoms seem to go away or greatly lessen, I don't know, permanently? Could you elaborate on that?
So dialectical behavioral therapy is a modified version of cognitive behavioral therapy, basically. But they're both designed to give a person effective coping strategies.
I see.
So being able to effectively de-escalate, your emotions to properly and healthily cope with them can improve your overall symptoms though. Like if somebody has to cope by self-harming, that we've talked about the negative effects of that. Like people with BPD who self-harm are twice as likely to commit suicide. It can increase dysphoria, which increases the risk of suicide, all that stuff. So if a person can learn to cope healthily in ways other than self-harm, they can regulate their emotions. That will be it will be overall easier for them to deal with the disorder as a whole. I don't know if there's such a thing as remission of a personality disorder like there is for some other mental illnesses like bipolar. But I don't have the numbers with me. I actually forgot to see this information, but basically people with BPD who find a plan, like a therapy treatment plan that works for them, and they stick with it, start seeing extremely positive results over time. Like, I think it was like over the course of 10 years, 80% of people saw just massive drastic reductions in their symptoms of BPD by sticking with and using their therapy and treatment plans. Their therapy, DBT, and like the other types of therapy are incredibly important for bipolar disorder and borderline personality disorder. And I'm not familiar with enough other of the personality disorders to say, but DBT was actually designed for people with bipolar and borderline personality disorder as a modification of CBT. So, like, if you have it, getting the therapy is the most important thing. Like, you have to find a way.
Mm-hmm.
You have to do something. You have to take the initiative of yourself and find the coping strategies. You have to.
That's awesome to hear, though, that there's something to be done. That they're actually, the initiative to take is out there.
Mm-hmm.
Yeah, it's one of those things though where it's like it's extremely hard to find what does work for you though. Like for me, a lot of coping strategies don't really work for me. My bipolar disorder and borderline personality disorder have been pretty treatment resistant. It took me a while to find medications that work correctly, and my medications still aren't perfect. I've been going to therapy for it for like 4 years, and I haven't actually had that much improvement. It can take a long time. It can take a long time. But there's a very positive outlook for for most people who actually can get into the treatment that works for them.
Yeah, it just sounds that sounds like it'd be very difficult under normal circumstances to commit to something for several years, um, let alone while also living your life and dealing with symptoms of BPD. That just sounds infinitely harder.
You know, I'm gonna go on a limb here and say, life with BPD kind of a little bit difficult. You know.
Yeah, I bet. I'd imagine based on the last hour conversation we've had.
Definitely sounds like a pain in the dick.
Oh yeah.
I like to like say like this is from my experience. Um, if the doctor give you a medication and it's ruining your mental health and you want to get rid of it, please do not go cold turkey. That is very dangerous.
Oh
Do not do
yes.
that.
Mhm.
Please.
Uh, go talk
Please.
to your doctor first, and if she's like not saying or he whatever saying, "Oh, I can't take it because you need it," and you feel like I don't really need it. Now, this is my experience. If you have bit worse symptoms than I, then you know doing your own distraction, whatever the word is. Talk to your doctor, and if he or she says, "Oh no, you need it," go get a second opinion, because if you really feel you don't need medication, um talk to your doctor, but please do not go cold turkey. It does not work. It really doesn't. It makes
It
it
it,
worse.
it is extremely dangerous to suddenly quit. All, not even just psychiatric medications, but pretty much all the medications that if your doctor gives you medication and tells you how to take it,
Yeah.
you should take it that way. Do not quit
Yes.
medications cold turkey. It can be catastrophic. It can be incredibly catastrophic with things like antipsychotics. Um, if you are not comfortable with your prescriber, I don't see a doctor. I have a team of a therapist and a nurse practitioner, and the nurse practitioner does my prescriptions, and side of the more like the psychiatric stuff. Um, if you're not comfortable with the person who's prescribing your medications, and that you don't think that they're if you're just not vibing with them, if you don't think they're really understanding you, like ask for a different one. Like their feelings won't be hurt. This is a huge thing. This is extremely important. If you're seeing a therapist or prescriber or doctor or anybody in that profession, and you think you would be better off with a different one, get a different one, please. Their feelings will not be hurt. You will not hurt their feelings.
Exactly.
Anyway, that's all for the mandatory content. Yeah, Andy, good point, Andy. If their feelings are hurt, red flag, and you need a different one anyway.
Mhm.
Very, very good point, Andy.
If you're also lucky to find like another alternative, so if I need to concentrate for something important, I think I take like natural supplements. I don't take pills anymore, but that works for me. Uh, but if like Tista said, if your your doctor's saying hurt your feelings, just go get another one. And if another one's doing it, keep finding one. Like it's not worth suffering your mental health just so you can satisfy one person who you barely know.
Yeah, you have to. You cannot just acquiesce to your prescriber because you don't want to hurt their feelings, or because you you should trust yourself. You should trust your gut
Yeah.
with what you
Mm-hmm.
feel is right for you. You should take into consideration, the opinions of medical professionals. You should do your own research, but if it doesn't feel right, you shouldn't do it. And people experience these things in all sorts of different ways. Not everybody needs medication. Not everybody needs therapy. It's effective when you have both, especially for like bipolar disorder. Having a combination of therapy and medication is much more effective than having one by itself. But there are a lot of people who manage their disorders and mental illnesses without medication. However, that doesn't mean that you specifically can do that, and it's not your fault. It's not a weakness. Like, I am so happy for the existence of these prescriptions, because I can definitely admit I could not handle anything if I didn't have these fucking what, lithium, lamotrigine, ziprasidone, fucking hydroxyzine, fucking what, there's like 5 medications.
Mm-hmm.
Like clonidine to help me fucking sleep so I don't have night terrors and shit. Like, I admit I fucking need this stuff, and it's fine. Not everybody does. Some people do. It's fine. Anyway, yeah. If you guys wanted to talk about, we don't have to. This is kind of extraneous, like DBT, CBT, mentalization-based therapy. If you want to talk about like the DSM, that's all. That's sort of like tangential. But we also do have the bipolar stuff, bipolar questions. If you guys want to talk about that, or whatever you guys want to do. Any other questions you had?
It is about 10-20 your guys' time. So maybe the extraneous stuff we maybe leave out right now, if that's fine.
Yeah, it's totally fine. Did we want to just go over the bipolar questions, the couple bipolar questions that we had, and then finish up?
Yeah.
Yeah.
I would like that.
Okay,
I don't
so
personally have any questions right now. I mean, I don't really know what to ask, but
okay. And I mean, feel free, like, if you come up with questions, like, after this is done, you can message me, post them in the Discord or something like that. I don't mind at all. About, like, the clinical side or my personal experience, the other one. So, anyway, Starry asked, what do I do when I'm manic?
Mm-hmm.
I have bipolar type 2, which means I don't actually experience full mania. I do experience hypomania, like hypo meaning like under. It's kind of like a lesser form of mania. I do get things like risk-taking behavior, the desire to, but I am usually able to restrain myself to spend more money than I should be. Irritability, lack of sleep. I think my record is 5 days and some amount of hours without sleep.
damn.
That was a wild time.
That's like just consistently being awake, like not even zoning out for a little bit.
Yeah,
before
just being like focused for 5+ days.
Man.
Jesus.
I don't really have that anymore. Like, I'm on my, like I was saying, my bipolar is actually fairly decently managed, like with the lithium as a mood stabilizer. Like, I don't get the huge swings in mood anymore. So, for my hypomanias, for me personally, they've never been a huge problem. A lot of people with type 2 bipolar don't really have hypomanias as a huge issue. The major issue for type 2 is fairly frequent, very deep depressions.
Mm-hmm.
My prescriber did give me a medication though. Once when she was afraid I might actually have go fully manic, she did give me a medication which can actually stop that. So, I mean, your boyfriend, if your boyfriend's scared of the mania, if it can be pretty bad, there are apparently medications which can be used to basically abort it if it starts getting bad.
Oh, he does have mood stabilizers if it does get really bad, because he had it since he's 30 now, so he had it since his, I think, teens, early 20s.
Okay. Well, that's good. As long as if it's managed, that's amazing.
Yeah. I just asked because never dated someone with it, and BPD is similar to it in certain extent, so that's why I'm like asking more of it. So now I understand his disorder a little bit more. So that's good.
Yeah. I mean, one of the best things to do. Oh, here's another great point. If you know somebody with a mental illness and you want to help them, one of the best, like probably the best thing you can do is ask them how to help them.
Yep.
Um.
Don't
Anyway, yeah.
at them, please. Don't. It makes it worse.
I'm sorry. What makes it worse?
When somebody's frustrated, because it happened to me a couple of times when
Oh, yeah.
it was really bad, and they were getting frustrated and they yelled at me. It made it worse. It made me withdrawn and didn't want to help, and so I stayed in my own little shell and didn't do anything.
Yeah. Um. Yeah. It is a risk. And real quick, the last question was type 1 versus type 2. I already briefly covered this. Type 1 bipolar people experience full manias, which are usually some pretty severe detachments from reality, hallucinations and delusions. Like you can obviously tell that something is wrong with the person. They're acting incredibly strangely. They're saying strange things. They think they are the second coming of God, of Christ. They think they're a messiah. They think they're a genius. They think they're incredibly special and unique. Just like Kanye West style breakdowns, because he is bipolar type 1.
I was about to say he's very narcissistic.
Yeah, it happens. It happens with. It makes me feel really bad when people criticize Kanye for a lot of things, because it's like this dude is just fucking bipolar as hell and is having a manic episode. Like, Jesus.
Sometimes you act like you just look at him like, is he okay?
Yeah. Yeah. And for type 2, type 2 doesn't get that. It's really much more depression focused, some very deep depressions. For me personally, I actually can have psychotic depression. I don't know. I think I may have mentioned this in my one post, but basically, like, I can get so depressed and so stressed that I just lose touch with reality and have psychosis.
And you can do anything to get out of it, or you just like ride it?
Grounding techniques. A lot of the time, self-harm is usually like the only way. It's like psychosis. Psychosis, very scary. If you haven't experienced it, I hope you never do. Fucking terrifying. Anyway, yeah, that's I mean, I guess that's all I've got. I think that's all I've got for you guys.
Thank you so much.
Very informative. Thank you.
I feel smarter now.
Nice. I did my fucking job.
I'm gonna go get some help now.
Yeah, no, that was great. Very impressive, very brave to just choose to hold this kind of a, public PSA sort of thing. To do the research to educate all of us and to just talk about it openly. Not a lot of people are doing this.
Need more awareness to this.
Yeah.
I mean, it's kind of what I figured. Like, I know a lot of people are probably suffering from this without having any idea of what's happening to them or why it's happening. They are misdiagnosed or undiagnosed. They don't even realize that personality disorders exist. They don't even realize that BPD exists, or they might have it. Like probably 1 in 10 people have a personality disorder, and I'm betting that the vast majority have no idea. So
The
I
way you like describe some symptoms, I'm like, oh, I have some of them leaked into my disorder, which is concerning.
I mean, I'm hoping that this was elucidating for you guys, for everybody listening, for everybody who watches the video. I hope it sparks some introspection. I hope it inspires people to get the help that they might need. And I hope it gives people the confidence to be open about it, because especially with certain personality disorders, like I also have a pretty high like passive aggressive score. Um, I'm very passive aggressive. Like oftentimes, if I have a problem with you, you will never know about it. Um, and
Oh.
it's really bad. So I've been working really hard to try and be more open about things. And
Mhm.
also with borderline personality disorder, um, it's also very important to be open, because one of the biggest things is that nobody can help you if they don't know how to help you, or that they don't even know you need help.
Mm-hmm.
Mhm.
Uh, so basically, just giving the people who need it, I guess, an opening to seek help is
Mhm.
what I wanted.
Which is a good avenue. It's just if we somehow got one person, at least one person who listens to this podcast or your stream and decides they want to get help or they want to start seeking treatment, that's a plus in my goal. Even if it's just one person.
Yes, yes, exactly. Even if it's just one person, I can die happy. Honestly, just one person, please. Or even a checkup. Yes, Nako, or even a checkup. If this has inspired you, you can just go get, just talk to a therapist once. You know,
Yeah.
if you can afford it, please just talk to a therapist just once. Just give it a try. It's very important. You don't need to have a mental illness to see a therapist also.
Exactly.
Um, yeah, that's it. That's all I got.
Also, if I may put this out there, it's good to talk to people, but don't make them your substitute therapist because nothing substitutes a actual therapist who's trained to handle these things and diagnose you.
Mhm.
Oh yeah, it's very important. I think a really good strategy is like if you need to talk to somebody for help, you should be very open with them about it. You should let them know what you need from them. Like if
Mhm.
I message
Mhm.
Salamander, like, hey, I just really need somebody to listen to what I have to say right now. Like, can you do that for me? And then if he says yes, then great. If he says no, then okay, I understand. You don't have like, you can't do that for me right now. It's fine. Or if I message Salamander and I say, hey, I'm kind of like in a crisis right now. Do you have like some time and like the emotional health to talk to me about this? It's probably the healthiest thing you can do. It's courteous. It's courteous. It's kind. It's
Mhm.
healthier for both people, because you don't want to just like dump an essay on somebody out of nowhere and
Okay.
expect them
Yeah.
to reply to it.
Yeah. Also, if like you're having like very dark thoughts, and your friend is a good friend and saying, I don't think you should talk to me about this. You look at somebody, and then and if you think like, yeah, maybe I should, because these are very twisted, dark thoughts that I need to talk to somebody who knows what they're doing and help me with this, rather than a friend. Like a friend that can be there to listen to you when you need it, but if you really need help, go to a therapist for sure. But if I'm like being super honest, you might not find the right therapist at the first go, uh, which is okay. Um, you're establishing a relationship with another person too. So if that person doesn't click and you have the money to like look for another therapist, highly recommend you do so to that one person click with you rather than you just tell a person that probably doesn't care about your mental health at the moment and just there for the money, if you get what I
Right.
mean.
Also, if you think you can't afford a therapist, seriously look into it. There's a lot of therapists who will charge on a sliding scale. Like if you don't make much money, they won't charge you much money. Or it might be subsidized by your state or city, or there might be some sort of program you can use. Don't just assume like I'm poor, I can't get therapy. Like
Mm-hmm.
you almost certainly have access to the internet. You have a brain. You can do some of the research to better yourself, to like give yourself the
Mm-hmm.
opportunity.
Mm-hmm.
And also, Andy made a great point in my chat. Many hands make for light work. Yes, it is bad to just constantly complain and dump all your emotions on the same person over and over again.
Yeah, no, that's a great point. I do want to just go out and say that Batista's scenario, it can be true. Anybody who's listening, you can always DM me and ask if we can talk about something. That's totally cool. Uh, if you don't know how to DM me, I'm probably in your favorite streamer's Discord. I bet.
God damn it.
Yeah.
Yeah.
But like everybody in this voice, if you wanna talk to us or just like wanna just vent, our DMs are open for you to lend the ear if we're able to.
Yeah, I'll also say it explicitly, like, yes, you please do message me if you have any questions about what I'm going through, or if you find anything relatable, if you're having issues with yourself, because now everybody knows, like, for the most part, what I'm going through, a lot of what I'm going through, maybe not in such visceral detail, um, but I hope that I'm more relatable. And people can feel confident in messaging me.
I do know you better now, that's for sure.
Yeah, I hope so. Yeah, I hope so. I've been talking a long time.
I was very happy whenever you first made a channel in your Discord server. By the way, everybody, there is a dedicated mental health channel in Batista's server. If you wanted to have an open conversation, but when you opened up about that, that made me really happy. I was like, I understand him so much better now.
That's good. I'm glad.
I never noticed that. That's really nice.
I think I need to go, like, eat and drink stuff. And also I'm sweating to death. So I'm gonna fucking peace out.
Okay.
All right,
Oh,
thank you for coming.
yeah, thank you very much.
Thank you guys for having me. This was really great. I really enjoy all of you. Please have me back again for various other topics. Thank you.
Well done.
Okay.
Good night.
Good
Good
night.
night.